Hello everyone, welcome to SQ TV Global. I'm your host Rajni Bharara, and today on the show I have with me again a very special guest. His name is Dr. Ashish Chauhan, and he is a physician and also a diabetes specialist. Today on the show we are going to speak with him about diabetes and everything related to diabetes. But before that, we would like to again welcome him to SQ TV Global, and we would like to thank him for taking out time and doing the show. Hello, Dr. Ashish. Welcome to SQ TV Global once again. And thank you so much for taking out time and doing the show.
Thank you, Rajni. Really appreciate this effort of yours and SCube TV, and it's gonna go for a long way in bringing the awareness, which is very much needed for our population in India as well as globally. So thank you for doing this effort of yours, which is very meaningful.
Thank you so much. Thank you so much for your kind words, Dr. Ashish. So, Dr. Ashish, now, like I mentioned, in the beginning, that we are going to today speak with you about diabetes and everything related to diabetes. So, before I ask anything about diabetes, my very first question to you is, if you can please talk about what is diabetes and what are the causes of it?
Diabetes is an endocrine disorder which causes the metabolic abnormality. And these are the medical terminology which I'm using. It's simple thing which we can understand. It is that we have to have a sugar in our body maintained between 100 to 150. That is a normal value. And whenever that sugar level increases, that is a time when it's going to create a problem. So, and it's going to affect heart, brain, liver, kidney, every part of the body. And that is what is diabetes in a simple term possible. So you and me have to assure that we maintain our sugars between 100 to 150. And when we do that, our body functions absolutely normally. And there are, as you've asked, what are the various causes? First, I will tell you the types of diabetes, which is important. There is something called as type 1 diabetes, which is very rare as compared to type 2 diabetes, which is very, very common. And third thing is gestational diabetes, which happens only during the time of, pregnancy time it comes. And then by the time pregnancy is over, it goes away in most of the cases. So now type 1 is most of us have it. We have almost, this is 65 million Indians are diabetics. We are called as diabetic capital of the world. And out of 65 millions, which I'll say 1% roughly will be the type 1 diabetes, and plus few percentages will be the gestational diabetes. So these are the three part of it. Type 1, you only require insulin and nothing works. Please understand, a lot of people keep trying and keep jumping to 100 doctors, 100 therapies, and which they get troubled with. Type 2 is what majority of you and me, our uncles and aunts, they get it. And finally, it's a gestational, which comes only during the pregnancy. So this is what is roughly diabetes all about.
So, Dr. Ashish, with this, my other question to you is, a lot of people who eat a lot of sugar, they don't get diabetes, whereas so many people who don't like sugar and who don't eat sugar, they get diabetes out of nowhere. So why does that happen?
That's a very, very meaningful question. See, what first I would want to tell all my viewers is you shouldn't compare yourself with others. Everybody, we all look same stature, same features, same ethnicity, but we do respond differently. Rather, two twins also from the same family, they end up being a different individual when we get married and when we settle in life. So two people from same family with same genetic material also differ. So these things which we need to understand. So it's a disease which is multifactorial. It's not one thing. There is multiple causes for it. Yes, if there is type 1 diabetes, then that is because there is autoimmune, there is an immunity which has got triggered and there is a problem. And if it is a genetic where the parents have got it, so your chances of having it is high. Then because of our stress levels, because of our obesity, that's why it's called as, if you understand, a lifestyle disorder, and it's called more as a diabesity in the right way. We have to speak it rather than the diabetes. So I wouldn't like to go into deeper aspect. There are biochemical and more explanations for it. I would want to make it simple for people. Instead of going into pathophysiology, make sure whatever you do, maintain your sugars between 100 to 150. If you can maintain while having the food, and only by good number of exercise you can do the sugar maintain. Do that. If you can afford to do it with the tablets, do that. If you can afford to do it with insulin, do that. So this is the way which we need to understand. And body's response to the food is different with different people. So if you are prone, suppose if you're a pre-diabetic, the people
Mhm.
who may become a diabetic, then you, even if you'll have one hundred one sweet piece also, and your sugar will start going to diabetic range. So, and then if your body is having a good production of insulin, your body responds well, then you will not even, you will have 100 grams of sweets and jalebis and all, and your sugar will remain same. So it is lot of it is about how insulin is produced in your body, which matters, which changes from individual to individual.
Any possibility of, in a lot of families, what happens is, because, I think diabetes is something that passes on to generation. It is genetic. So, when in a family, is it possible in any way, if the parents have got diabetes, so their children might not get, or is there any cure for that?
Yes, very much. I wouldn't bet on the percentages. I'll tell you a very simple thing. My mother had diabetes and my father had hypertension. And so because of the virtue of my mother being a diabetic, my chances are high. Because my father had hypertension, my chance of hypertension is high. What do I do? I need to monitor the few modifiable factors and non-modifiable. Modifiable factors is eating less. See, by the virtue we are Indians, or overall, we eat much, much more than what our body requires it. Everybody, rather, I keep telling that if a patient is a Telugu patient, then even if the son is a sumo wrestler kind of physique, the mother always thinks my son is very, very thin. So that people do not accept and understand what is a healthy living. And if we maintain our physique well, if we maintain that we are not going to eat too much of sweet. See, देखिए problem क्या होती है, if you have to understand it, is one piece of sweet is okay, but having 4 5 rasgullas trying to show off one portion of biryani is okay, but making sure that we start only with 4 times the normal and then we keep adding more, then definitely you're going to have a diabetes, you're going to have hypertension, you're going to have heart attack, paralysis, kidney failure. So everything will fall in line. It's all about having a proper balance. And if you are able to do that in your diet and exercise, and above all, going to a doctor regularly. See, biggest problem which we find, Rajni, which I would want others to know, it is we want to avoid doctors till the time it is last stage, and by that time, poor doctor doesn't have enough choice but to give you the more high dose of medicines or even insulin. So things can be prevented. The only thing is patients come to us for curative approach. They do not come to us for preventive approach. Whenever I see, every time I get a patient who comes with diabetes, I immediately look at the children. I'll say, Baba, you will be getting in 5 years time. But they will not take life seriously. They know it's a nahi nahi sir, aaj sugar test kara, it is normal. So people don't understand. And with your channel, I would want to tell, complication of diabetes start before the diabetes comes into existence. Suppose you have a diabetes detected today, and suppose you are supposed to get a heart attack in 5 years time, then the possibility of heart attack started 10 years before, not the 5 years before. People need to understand that microvascular and macrovascular complications of the diabetes, they start even before diabetes has come into picture.
So, doctor, you actually have, explained it in such manner, and how the complications get way ahead of time before you actually get the disease. So now my question is, you spoke about the complication of diabetes. So what exactly are the complications of diabetes, and what kind of people are more likely to get diabetes?
See, what we need to understand is there are different ways of knowing whole thing, but I will give you a few facts. The
Mhm.
number one cause of blindness in the world is diabetes. It's a very well known.
Yeah.
14th October was a World Sight Day, and we wanted to tell, मीठा बोलिए, मीठे रहिए अपने स्वभाव में, but मीठा कम खाइए. This is what I would keep telling everybody. Speak sweetly with the people around, have a sweet behavior, but consume less of sweets, because it will make sure that 20 years down the lane, you will be blind because of uncontrolled diabetes. Number one. Number two is, number one cause of kidney failure around the globe is diabetes. Very, very big number. Kidney failures are increasing. Number three is 85% of non-traumatic amputation. पैर काटना, काल की तीड़म. So if there is non-traumatic cause, accident nahi hua, but without just there is leg got infected, the number one cause of a leg amputation is diabetes. With these facts, the number one cause of heart attack is diabetes. The number one cause of the CVA, or what we call paralysis, the cause primarily is because of uncontrolled hypertension. But yes, if you have uncontrolled diabetes, then your chance of getting the CVA or the paralysis is very high. So with that background, facts are scary. Every 6 seconds, when we lose one patient because of diabetes around the globe. That means in 1 minute, we have 10 people dying. By the time we finish this show, it will be almost in 1 hour's time, we would have had 600 people died around the globe because of diabetes. So it's a big thing. You and me need to work on these complications.
Yeah.
And they are reasonably controllable if we start it earlier. The delay, the longer delay we take it in approaching the doctor, we keep scared. Say, abhi hota kya hai? I've seen in my private practice or in Apollo also, people try to save 500, 5,000 rupees. We'll go to doctor, he will write so-called unnecessary test. When they try to saving 5,000 rupees, they end up paying 5 lakh rupees regularly. Every heart attack, every paralysis which gets admitted in any hospital is preventable had we controlled the diabetes much, much earlier. So that we need to understand it. Now, you had asked me about the complication of diabetes. सिर से लेके पांव तक, right from head to toe, every organ gets affected. We need to understand that very much. I always like to give some acronym to remember. Today, I would want to give you an acronym of diabetes. D is a diabetic ketoacidosis. That's a life-threatening, acute emergency which happens. Diabetic ketoacidosis. And a lot of people, young children, when they get type 1 diabetes, they only get to know when their sugars are 500. That is with 3 years, 5 years, 5 years old. Children also get it. So diabetic ketoacidosis, we can prevent it if you have a glucometer at home. I is for, infections. Diabetic will have higher possibility of normal infections. COVID kills them more. Pneumonia kills them more. They will have more of urinary tract infection. So every infection, genital infections will be more in case of diabetes. A is atherosclerotic diseases. Atherosclerotic means blocks in the plaque, in the heart, in the vessels. That is what is heart attack. That is what is paralysis or the brain involvement. So DIA. B is bowel involvement or motions. Diabetic people are usually very, very constipated, or they have a frequent stools. Khaya or turant they have to run to pass the stools. 90% of diabetic patients will have constipation. 10% have diabetic diarrhea. 6 bar they have to go, 6 times, 5 times they have to go for passing stools. So that is what it is. E is what I have already told you, the eye involvement, diabetes. So E is for eye involvement. Number one cause of blindness around the world. Dear diabetics, please make sure your sugars are controlled. T, I have told you, is a toe involvement. Toe is a leg involvement. 85% of non-traumatic amputation, आपका जो पैर काटा जाता है, that's only because the sugars are uncontrolled. So that is we need to understand. DIABET. E is for ESRD. ESRD is end stage renal damage. Okay, kidney failure. Number one cause of kidney failure is diabetes. So now DIABETES. Finally S. S is the most important thing. And I would want everybody to focus on this X. S. What does S do? The S thing causes the more and more number of divorces in the family. S is for the sexual problem. Every diabetic talk about it. Doctors also don't ask. They will not get proper erection. They do not get proper erection. Women will have, there is loss of libido, there is lubrication which is decreased. So they will have that painful sex. So best thing is ki, sir, bache ho gaye hain. Now they both don't like to talk about it. So sexual problem, sleep problem. Diabetic patients will not get proper sleep because of uncontrolled sugars. They will have sensory neuropathy. काल चेतलु तिमिर मंटा पैरों में जलन होता है कि they cannot get sleep properly. So sensory problems of the legs. Then finally S is stress. Diabetic patients are the most stressful people. Kyun? Sab, we're taking so many medicines, but my sugars are not getting control. So if you take these S, sexual problem, sleep problem, sensory neuropathy, and finally is stress. These all are complication. A divorce, I feel so laughable because I openly talk about it with my student also. Dear friends, start talking to your diabetic patient about the sexual impotency or erectile dysfunction which they have it, and work on it. I hope this acronym will help you and my viewers to understand the various complications of it, and they can be prevented by going to a good doctor, by sticking to your doctor, and listening to your three people will save you from reaching hospital. One is your spouse. Don't try to control your sugar by yourself. Take your help of your spouse, wife or husband. Second thing is your boss. Your boss only will tell you, yaar, aajkal tum kaam theek se nahi kar rahe ho, go for this health checkup. Every corporate hospital, every corporate world nowadays provides the health checkup. There are people who have got every year testing provided by company. They don't do it 3 years, 4 years. Arey sir, everything will be normal. Finally, your children. Listen to your children. If they are telling you, ki, Papa, please go, if they are staying in their NRIs, you are in India, and they are telling you, please go for the checkup, please go for the checkup. So with my message will be, listen to the people who love you the most, and they will make sure that you live the most.
So, listening to you, it is such an eye-opening discussion that we are having, because, I think, doctor, not many people know, and also not many doctors, not many doctors also tell their patients about diabetes in such a way that you have explained, right now. So, I don't think people imagine diabetes being such a big problem, and I mean, diabetes can be, you know, not only a disease but a lifestyle problem,
It's a big
basically.
problem. It's a big
Yeah,
problem.
it's a very big problem. Yeah.
So the what you're trying to tell, and that's what I want to tell, is diabetes is diabesity. If you're obese, your chance of diabetic is very high, and if you're diabetic, you will be obese because weakness hota hai. Lot of people. Another acronym I would want to keep giving it because, say, I would want to scare and I will give the right kind of facts. A lot of my friends tell, Ashish, when you say so many things, patients they don't like to listen. Sir, नहीं sir, कल मैंने वो एक yesterday I went for biryani. That's why my to a wedding party, and my sugar right now is slightly on the higher side. I will be able to control it. This pseudo confidence, I will be able to control it, gets them into ICU. It gets them into heart attack. Lot of patients they say ki, my friends also tell me, Ashish, why do you want to explain it to them? They will not listen. And yes, that is there. I found them that they're 90% they're right. And when you take a small fee of 500 rupees and you try to explain, when we talk about, they say when they get a heart attack at night 2 o'clock, they are very happily they will be spending 5 lakh rupees, and it's always better to tell it to them at that particular time. So we also have issues in India. We do not give respect to the preventive approach. We always go for the curative approach. And the only problem in that curative approach is what I would want to tell you and all the viewers is, if a diabetic gets heart attack, paralysis, kidney failure, or heart attack is a big killer, half of them only get this 40, 50,000 or 1 lakh, 2 lakh, 5 lakh rupees of treatment. Half of them die on the way. So even if you have a 20, 40, lakhs, money is not an issue. Half of the people who get heart attack because of diabetes, they do not reach alive to the hospital. So make sure prevention is the best, cure, or the best approach and the best treatment. And you and me should work on it.
I mean, I think it's about time that we really work on it. And, rather than looking for cure, we should rather look for prevention of diabetes. And, you have explained it in such a great way that how diabetes can actually, cannot just be a disease, but it can actually mess with your whole life, with your family, with everything
Yes.
around you. So it
See,
basically
that's
can
what
mess
I
up
say.
with your life. So Dr.
Even with
Ashish,
the
now
hair loss, so I say the
yeah,
whole sex life which gets affected, your bowel movements are affected. You will be
yeah,
sitting in the meeting and you will have to run to pass stools. So those kind of weight is a very, very tough call. So I definitely would want people to understand that attack at the diabetes before diabetes attacks you. So that's what the approach which I would want to leave.
absolutely, absolutely. So now, Dr. Ashish, also my other question to you is, you actually spoke about prevention is better than cure. So now, if I talk about prevention, so how can we prevent diabetes from happening?
Having a good control on your eating habits, working on your exercise every day. I would want to give you a few numbers which are very, very important so that the youngsters and the IT people understand it. You want to live for 100 years, 100 minutes of exercise per day. Very, very simple. Say, Sahab, no pain, no gain. You
Yeah,
can't afford to live 100 years by exercising 20 minutes or 10 minutes. No, 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 no. I know we all are busy people. Have 20 minutes exercise in the morning, 20 minutes afternoon, 20 minutes evening, and half an hour post dinner. So 100 minutes of exercise per day is very, very important. So work on that. Maintain a good, weight. Your height minus 100. Suppose Indian women or Indian men, they all are between 5 feet to 6 feet. Only the very good tall people will be 6 feet. So 5 feet means 50, and 6 feet means 80 kgs, and that's what we need to have it. Ladies need to have a height and weight roughly around 50 to 60. That's a weight we need to maintain for Indian women, and gents need to maintain 70 to 80. The time, suppose I'll again give the proper example. Suppose somebody's height is 5 feet 10 inches. So 5 feet 10 inches is almost equal to 175 centimeters. They should have a weight of less than 75 kgs. That is if you don't want to have a diabetes. But if you're already a diabetic, then you need to be 90% of that. So suppose if you're a woman of 5 feet, so that means 150 centimeters, then your weight should be 50 kgs. But if you're a diabetic, that should be 90% of 50 kgs, which will be 45 kgs. So make sure you have a good diet, a healthy diet, which is low on calories with respect to the carbohydrates and fats, more on proteins and minerals, and not having the fried food, staying away from beverages is a very great idea. Having healthy lifestyles, no smoking, no alcohol, that kind of thing usually helps a lot. And proactively going to a doctor. See, there is one person who can save you from doctors. Take my words, I'm very sure people would want to know who can save you from a doctor, and that one person is doctor himself. You go to a doctor when you do not need him, and you will never need him. So when you say, "Ki, sir, I have holiday time. I want to, please go and meet your doctor. Wait for him. See him when he's, a free time. You meet him, and you will not have any issues." So this is what I will need it. Finally, I will need an acronym to leave again, which is very, very important for me. Diet is most important thing. The time you are having a good control on your diet, contact your dietitian, contact your nutritionist, and she will help you out in staying in the good figure. So D is for diet, I is for insulin. The time your doctor tells you take insulin, please take insulin. E is for exercise. You can't afford to say, sir, मैं tablet खाता रहूंगा and I won't require, I will not go for exercise. No. And T is for tablets. So these are the four things. If you focus on diet, insulin, exercise, and tablets, you will stay away from doctor, you will stay away from ICU and emergency. This is what I would want to leave it here.
Great acronym. And I think people should really, if they can't remember it, they should note it down somewhere, and they should, really work upon it, because that's a great acronym and great advice and tip how, can people follow and can prevent diabetes from happening. So now, Dr. Ashish, also my very important question, my next very important question to you is, now there are a lot of substitute for sugar in the market in the name of sugar free and where they say that this does not contain sugar. So you can have it, or you can add it in your tea or whatever you would like to have. So would you recommend that? And also, people are also saying, I don't know if it's a myth or what, but I have heard that people say that those kind of substitute and those kind of products also cause cancer. So is that true?
Partially true, partially no. And I would
Okay.
want you to understand by old statement by our mythology, and we have heard, Ati ka bhala na barsna, ati ki bhali na dhoop, ati ka bhala na bolna, ati ki bhali na chup. Decrease on your sweet intake, and even for those aspartame, or all those sweeteners which you can use it, that also you can use 1 or 2 packets in a daytime. If you
Okay.
are going to make 1 kg sweet out of that, and then want to consume that 1 kg of sweet in a day, I think nothing can save you. Say, anything in excess is bad. So even say, a lot of people used to say, "Sir, is dawaii ka koi side effect to nahi hai?" Arey Baba, there will be side effect of every medicine. If a medicine has to have an effect, there will be side effect. If there is no side effect, means there won't be any effect. Even if you are going to eat pure ghee 1 kg every day, you will have a heart attack, because that will go. So anything in excess creates a problem. Regarding this aspartame or whatever the sweeteners which are there, you can use it comfortably. Quite often when I go to places where I would want to have a tea and I take 1 packet, that does the work, but not more than 1 or 2 packets. This is what I would want to suggest everybody. So, and potential of cancer. Everything in the world has a potential to cause cancer. Rather, this month of October is apparently the cancer awareness month, or the breast cancer awareness month. Everything around us causes cancer, okay, which we need to understand. Too much of medicine can cause a problem. Obesity causes cancer. Diabetes also causes cancer. So control it before it is too late. And yes, whether those products can cause cancer, there is a possibility. I wouldn't go into deeper thing. Aaj aapko whatever you are eating, there are cancerous products which are there in your and my food every day. So staying away from the processed food is very very important. Sir, वो
Mhm.
फ्रेंच फ्राइज की आदत पड़ गई बच्चों के लिए. देखिए रजनी, I would want to tell you one thing. I don't know who all are watching this program, but this program is meant primarily for the one person who is the most important person in your life, and that is your, the women of the house. Health and the wealth of the family is in the hands of the women and women alone. So all the mothers and sisters and daughters who are watching this program, they need to understand. Thing is, we husbands or the men are the poor people. आप उनके सामने जो रख दोगे वो खा लेंगे. आप
Mhm.
5 दिन तक you keep giving the processed food, they will keep having everyday processed food. You every day you put the cut fruits and the salads, green leafy vegetable, they will have that. They will show resistance once or twice, but जब सब होगा ही नहीं सामने बनाने के लिए, they eat it. So
Yeah.
I rather would want to tickle the or inspire the nari shakti कि मैम जो घर है, घर की health and wealth आपके हाथ में है. So for heaven's sake, you must avoid processed food, French fries, adding extra salt to the food, or too much of sweets. Don't put 1 full kg of box in front of your husband or the
Mhm.
sons. Keep only one pieces. 4 लोग बैठे हैं, आप 4 pieces लेकर के जाइए, रख दीजिए, पूरा बॉक्स मत रखिए. Whenever any sweet is good, we all tend to go for the second serves, and that is what creates the problem. And last but not the least, if any one of you want to stay away from diabetes, want to stay away from obesity, or want to lose weight, the best answer is कि साहब, don't go for second serving. कुछ भी जाना है, कहीं पे भी पार्टी में जाइए, first serving is enough. No second serves at all.
Another question to you is, what is the right weight for a diabetic patient?
What is the right weight?
Right weight.
Height minus 100 into 90. So if your
Okay.
height is 170 centimeters, then it should be
Mhm.
70 kgs. If you're a non-diabetic, 170 minus 70 minus 100 is 70 kgs. If you're a diabetic, then 70 into 90, 70 into 0.9, that is 63 kgs. So height minus 100, if we can maintain it, that is good idea, and we all need to try to maintain our weight accordingly.
I mean, that's a great way to actually, keep control of your weight, I would say. So with this also, what are the emergency warning signs, and what should one do if they are experiencing them as a diabetic patient?
See, there are a lot of, you have asked a very good question. Diabetics get a heart attack and they get a silent heart attack. What does that mean? They don't get chest pain. Unka heart ka pain nerves are damaged. The only thing, they will never have chest pain. What do they have it? Suddenly they will be having perspiration. पसीना बहुत आ रहा है, कमजोरी लग रही है, कब बहुत ये सर मैं गिरता जा रहा हूँ, ऐसा है. I have the feeling heaviness in the chest is what they will get it. They may have the pain which they will perceive as a, sir वो कल चिकन खाया था उसके बाद से थोड़ी गैस्ट्राइटिस हो गई है. So you will not have the pain. They will have heaviness. They will not have chest pain at all. And at that, the loose stools vomiting, the acute gastroenteritis, that can be the symptoms of heart attack. So just because 4-5 बार loose stools हुआ है, 2-3 बार vomiting, acute gastroenteritis is because of inferior wall MI or the heart involvement of the inferior wall of the heart. If that gets damaged, you will have it. So what are the warning signs? Whatever investigation your doctor advises, whenever, please do it. Please do not challenge your doctor, whosoever it is. Say if you have gone to a doctor with some faith. When you're going with a faith and then you say, sir, ये बहुत commercial doctor hai. If you have a doubt, you want to go to another doctor, please feel free to go. But I would want to tell you, doctors are very, very bad communicators and orators. I am the exception. They whatever you put into their mouth, they will tell it to you. आपको say you are having some kind of retrospaternal burning, कि आपको gastritis लग रही है, which actually is heart. Doctor knows it and he will say, कि sir, let's do the ECG. And at that particular time, if you say, Doctor Saab, there is nothing big, no, it is only gastritis, no, he will also say, yeah, it is gastritis. He will write ECG on one side, but he will say, sir, you are absolutely right, it is gastritis. You won't want any heart attack for 100 years. Answer is 100 ECGs. Whenever your doctor orders ECG, that, Gundel Patti test or the heart cut test, please do it. You want to stay away from hospital for 100 years, visit your doctor in the OPD 100 times. If your age is 50 years, you want to live for 100 years, 50 more years, then go to the doctor. Another every 100 days, you must go to a doctor. These are the things which they need to remember.
Okay, with this one last question to you, Dr. Ashish, before we let you go. So one last question to you is, there are a lot of diabetic patients who have a habit of drinking alcohol. So even after they get diabetes, they can't control the drinking alcohol because of the craving for it or whatever that you would call. How harmful can alcohol be for a diabetic? Explain that. And then also, if a person...
Yes, I get the
alcohol,
question.
please?
Yes. Say what I would want to tell is, there is something called as obesity, which most of us diabetic patients are. Most of the diabetic patients are alcoholic or they are obese. And the worst combination if they're obese as well as alcoholic. Say alcohol definitely affects the liver. And even for that matter, even smoking. Say diabetes causes heart issue and smoking also causes heart issue. So first and foremost, I would want to give a slightly a small things to all the sisters and mothers and daughters out here. The person who you love you the most is the person who's got diabetes and he is addicted to both smoking and alcohol. सबसे पहले उनकी smoking छुड़वाइए. ठीक है? Every cigarette decreases the life by 11 minutes, and cigarette, there is nothing good about it, and it will always have a lot of issues which you need to address upon it. And so even if you have to bargain it out, though I'm not in any way, I will not say that alcohol is good because it causes a lot of other problems. But yes, moderate consumption of alcohol they have found is good for the Westerners, no, not for Indians though. And yes, the another thing to understand it is sometimes you drink less alcohol, but the alcohol ke saath one thing most common is the snacks. So that snacks actually will be increasing your sugars much more. So I would tell everybody, stay away from 7S if you don't want heart attack. 7S. Number one is sugar. No extra sugar to the एक चम्मच डालना है चीनी. If you're not a diabetic, 1/2 spoon is good. Salt, extra salt to the right. Jada namak is not. Spicy for all the ladies. Please don't make too spicy food for your husband or your family member. 3S. The fourth one is smoking. Fifth S is spirits, alcohol. Sixth S is sedentary lifestyle. You want to TV देख करके आप खाना खा रहे हो and you're just lying down and having sedentary lifestyle, not good for you. You want to live for 100 years, 10,000 steps of walking every day. Okay. And the final S is stress-free life. If the 7S people remember it, I am very sure we Indians will have the highest life expectancy. And finally, the eighth S, which will keep them healthy, is Scube TV. So if they keep watching our programs and all these awareness things, they will stay healthy. And that's what I would want to leave it to everybody else. Finally, I am Dr. Ashish Chauhan, available for you for every WhatsApp message at 810-612-7475. Yes, 810-612-7475. I'll be very happy to help you out in any doubt you have it on message. I will take time, but I will reply. If you want to see me physically, I'm available at Apollo Sikandrabad from 11 to 4, and you can come over. That will be great. Most important point I want to leave at this COVID season is you do not need to go to a doctor nowadays. He's available at online. I am available or online consultation. Take it. Why do you want to, अरे कौन बाहर तक जाए? Your father, mother is not well, doubtful, थोड़ा सा sugar बढ़ा हुआ है. Take online consultation. Medicines are available online. Lab tests are available online. Let the technology make you live longer. So stay healthy, stay happy, and stay smiling always. With Scube TV is what I would want to leave it with all the viewers of Scube.
Thank you, thank you, thank you so much, Dr. Ashish, for your lovely, lovely, kind words. And again, thank you so much for coming to SQ TV Global and speaking with us. It was so lovely having you, and it was such an enlightening conversation. And I'm sure the audiences must have gained so much out of this discussion that we had. So I would like to thank you again.
Thanks a lot, Rajni. It was absolutely blessed, time with you. And having that smile takes care of everybody's, sugars also, and controls the blood pressure. So thanks a lot being the wonderful, anchor for this program. Thank you. Take care. God bless.
Thank you. The pleasure is all mine. The pleasure is all mine. All right, guys, that's it from SQ TV Global. Keep on watching and don't forget to subscribe to the channel.